Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Residential treatment centers or rehab centers provide treatment for a myriad of issues, including mental disorders, behavioral issues, and substance abuse and addiction problems. They provide 24-hour care, allowing for individuals to pursue therapy away from the stress or stressors of their home environments. But how do residential treatment centers differ from inpatient treatment programs? When will you know when someone in your care might benefit from admittance to a residential treatment program? And what can you expect once you or your loved one gets there and gets admitted? Well, today we're going to get the answers to those and other salient questions related to residential treatment programs. And I can't imagine a person I'd rather have this conversation with. He's going to help us unpack all of this. Help me welcome Christian Jacobs. He's a marriage and family therapist and a trusted Brother Be Well clinical advisor, a buddy of mine too. What's up, Christian?
Hey, how's it going, Michael?
Really good, sir. How are you doing today?
Oh, pretty good, pretty good. Not bad. How about you?
Doing pretty well, pretty well. Been looking forward to this conversation for a long time, so let's dive right into it. We produced another video, Brother Be Well video rather, on inpatient treatment programs, but for the sake of this talk, please tell us about residential treatment centers and how they differ from inpatient centers.
Sure. Well, residential treatment programs, they're a bit similar, but they have a lot of differentiating factors that are related to billing and things of that sort. But they really provide that intensive help for youth and adults with that serious mental, emotional behavior problems. And while they're receiving that residential treatment, the patient temporarily they do live outside, their home, and in a facility where they could be supervised and monitored and trained by staff. And a lot of times the inpatient rehab is usually a minimum of 28 days, give or take. It can really vary during the patients live in that closed environment that I was talking about. That treatment center actually provides really a safe place though. So it's a locked facility. It's safe. It's you can't go in and out as you please. People can't come in and as they please, things of that sort. So it's really safe for patients to really undergo some intensive treatment that they need, so they can get prepared for outpatient and be and able to go home eventually. And actually, Michael, one of the most important aspects of the inpatient treatment really is that you will have immediate access to those clinical professionals and those doctors and the therapies while you're in those stages of recovery. So in treatment, inpatient facilities are, like actually there's a couple here in Sacramento, but the one on Stockton Boulevard, they're really for patients who pose a risk to themselves or others. So it's more of an acute risk, type facility, who are gravely disabled, and they need to be assessed at that point in time to really determine their proper care treatment. So those are the difference between the two and how they both look.
I really appreciate that, Kristen. And as I said, we've got an inpatient treatment program video on the platform as well. Go to brotherbewell.com if you want to check that out. Appreciate you differentiating between the two for us, Kristen. Why don't you tell us some of the common conditions that are successfully treated via residential care?
Well, I think the most, excuse me, I think the most common one is the substance use disorder. So most individuals know when someone goes into a treatment program, they go to a residential facility, right? Which are most common in the inpatient rehab facilities. They have it's 24 hours. So that's really where some of the conditions that you may suffer from something that's really debilitating, whether that's a substance use issue or something where you need a multidisciplinary team to treat you. So you need a psychiatrist on deck and a therapist on deck and a rehab specialist and a nutritionist. So you can't really do that inside of an outpatient clinic, right? So that's really some of the common conditions that you see. Severe depression, someone is severely depressed where, they don't move much, they don't talk much, very catatonic people. Catatonic meaning, they could be in a vegetative state where they're not moving much or they don't talk much. People who deal with like severe anxiety and especially psychotic issues. So those are some of the main things you'll see looking into those facilities.
And you just begun to touch on some of the cues that I was going to ask you about, Christian. How might a parent or caregiver best know when someone in their care might benefit from a residential treatment program? I'm also wondering here if a residential stay always follows an inpatient program. Is that always the case, or sometimes, rarely? How's it work?
Sometimes it doesn't always, follow inpatient program. Actually, it would probably be either or sometimes, or it's both. So sometimes if someone is in, for example, an inpatient facility, they came in due to having psychotic features, and now they baseline where they're more stable. If they have a stable environment to be transitioned to in terms of the community, they can either go to a board and care or room and board, or maybe they have an apartment or a family or a relative to stay with. If someone needs a little more help, they're not really ready to like fly on their own, for lack of a better word. You'll have those inpatient programs, right? Those residential treatment programs where they have some freedom, but they still need to be seen. So, and to the other part of the question, when they've been on a 72-hour hold, right? A 1 week or a 2 week hold, or sometimes a 1 month hold, and they are stable and baseline, but still need that medical oversight. The medication component comes in, so that's where it's important, where they're still connected, so they can receive that medication and be overseen. Someone can oversee them. Now, here's another thing: a lack of housing can also be a main contributor. So, if they don't have a proper place to go to, where they need that support system and that place to live, a residential treatment center may be a good place for them, or maybe a room and board or board and care, where they can eventually transfer to a housing facility. But being admitted into an inpatient program ultimately does not, always mean, being admitted to a residential treatment facility. It can be either or. It can be either or both. It's really based on how the patient is presenting after being evaluated, going through that those 1 month hold, 72-hour hold, things of that sort.
I really appreciate you helping us sort all that sort all of that out, Christian. I also appreciate the information about the unhoused. It hadn't occurred to me that might be a really great move for someone who's unhoused and managing or dealing with a mental health disorder. That residential treatment program might really be a lifesaver. Would you say?
Oh yeah, I've seen actually, Michael. I've seen times where an individual may have baseline, meaning that they've come out of their psychotic state, but the doctor sees fit that they would not be best going back to the street. Maybe they're homeless, and they'll hold them a little longer to either try and find them temporary housing, maybe a homeless facility. So they would hold them because they feel that being homeless is a risk in terms of their life and their care. So yeah, that does happen.
Wow, I really appreciate you walking us through that, Christian. Talk to me about this a little bit. Anyone can have themselves admitted to a residential treatment facility, but I'm wondering whether someone might be committed to one against their will. And I struggle with that word. I think, frankly, the word committed to is part of the what drives stigma around mental health. So we can come up with a better way to put it. But I'm wondering if someone can be committed to one, they in their mind, they really don't think they need it, but those parent and caregivers around them know they need a certain level of intervention that can be provided in the home. Is that accurate?
It's possible. No, and it really depends on what type of facility you're talking about, right? So let's go back to the inpatient center, right? The inpatient unit is more for acute care. So someone who just had a psychotic episode, someone just started hearing, having hallucinations and hearing voices, they need to kill themselves, for example. That inpatient facility, they may be voluntary or involuntarily admitted, so against their will. So, for example, if they're harmed to themselves or others, or gravely disabled in that state that they're going through, they may be involuntarily committed to that facility, just because for their own sake. Now, you have other like residential facilities, or maybe a little different, so the criteria may be different, where it's not as acute. For example, you have like there used to be like Stanford Children's Home, used to be River Oak Center for children, where these places are. These children are held in these these high risk homes, right, per se, cottages, and they're there against their will. They've either done something, as a adolescent or a child, that may be detrimental to their safety, and they really have to stay there until they rehabilitate, or their parents become more stable. Maybe they're in some type of program, substance abuse treatment center, where they become more stable so they can receive their children. So it really does depend on like the situation.
Got it. Got it. Really appreciate you walking us through that as well, Christian. Some of the guidelines or the rules, and you touched on a couple of these a little bit earlier, that have to be followed by residential patients might be unsettling for some of us. The one that I'm thinking of, most of us today have grown attached to that cell phone, and I understand that in a lot of residential treatment programs, you're not allowed to have that telephone, that cell phone with you. What are some of the other guidelines that are common to residential treatment facilities? And more broadly, what can one expect to experience once you arrive and you get checked in? What's next? What does it look like?
Yeah, well, I think first, it's more like a hospital setting, right? And there's a lot of movies out there that kind of shows the facility, and it looks like a jail, things of that sort. There's a lot of myths and stigmas, like through Hollywood, that show some of these facilities, but some of them are really nice, and they're also managed and maintained by law and by the state, so they have to keep a certain level of upholding of cleanliness, things of that sort. So some facilities may not allow like guests, or for certain amounts of time. They may not be able to come in for the first 3 days, or for their whole stay, or maybe for a week or so. So really, that's really due to their condition. Sometimes that's put in place. So say that person came in because they reported that their girlfriend, broke up with them, and so they try to commit suicide. Well, you're not going to let that girlfriend come visit in that day, because it may trigger them again. So there's reasons why for the visitation part. They also may ban cigarettes or alcohol or drugs, or actually not may, they do ban those type of things, especially like for substance abuse treatment programs. I think the most difficult for most is you cannot leave the center, right? You can't go get your nails done, go get a haircut. You can't, leave and go to the mall and get some shoes, or go to, CVS and grab some soap, or, a toothbrush. They don't allow that. They have everything you need pretty much there. Unless it's transported. No weapons, so there's always a no weapons rule there, whether that's knives or guns or anything that can be made into a weapon. And also, some facilities, such as some rehab facilities, will prohibit dating too. So they don't want you to date either the first year of being in those programs too. So and something else is there may be mandated therapy sessions, or art classes, NA classes, AA classes, group therapy, things of that sort. So there may be some of those requirements too once you get in there. So that's what it will look like pretty much once you set foot in those buildings.
Sounds like a lot to keep track of, but all set up for the best outcome for the patient. Sounds like it's all might be a little jolting going into it, but it's all for the care of the patient. You'd agree?
Absolutely, absolutely, yeah, and it can be. And I think in the beginning, once you get there too, just to kind of what they do a lot of, they hand you a pamphlet. It's a it's a user's rights pamphlet, so it shows what your rights are, what the laws are, what your rights are in terms of visitation, calling someone. So by law, they have to give you that pamphlet that tells you what your rights are while you're there, to kind of help ease the pain that feel like you're like a prisoner.
Yeah, and it wouldn't hurt for the patient and the family or caregiver to take a copy of that pamphlet so everybody can study up and know what's expected of him or her. So that sounds like a great
Right.
idea to me. You mentioned intimate partners, girlfriends, boyfriends, whatever, that aren't able to visit someone in a residential center. And that prompts me to ask this question. In years past, I believe that essential tenet for most mental health treatment programs was family exclusion. Back in the day, decades ago, that was discouraged, family getting involved. I believe things have changed a little bit, but correct me if I'm wrong on that. Today, my question, Christian, is how involved should family members be in the treatment of someone in a residential center?
Based on, okay, I'll say this: based on the right circumstance, and the correct, positive, healthy, strength-based circumstance, very involved. So I go back to that example I gave you, right, about the breakup, right? If that person who that they're connected to is toxic, right, and there's a trigger for them, it's probably not a good idea for them to be involved. But that will be determined through the assessment, right? Once you assess them, find out your relationship with them, and what happened, and things of that sort. But once a patient is admitted, they have the option to list any collateral members, in their family who are allowed to check on the status of the patient and call into the facility, and actually they'll be used as a reference. So believe it or not, one of the doctors and the therapist, their biggest strength that they like to use is the family, because the family has been seeing these behaviors, right? And we're laying our eyes on them for the first 10, 15, 30 minutes a day, or a day. So they know more, they can give more history. So, and actually, by law, you're able to use that collateral information as part of your assessment. So they say, oh yeah, this person's been dealing with, these issues since they were 8 years old, and they've been, having outbursts and, arguing and fighting. You can use that information for more background to do your assessment. So very important. Also, patients who have a family and a support system, they do better in treatment. So it's really been proven, through studies that, individuals that have more family support and friends than those who do not, or they don't write anyone down, they don't have a support, their outcomes are better. And actually those facilities can be very lonely, you don't know anyone. So it's really good to have someone to check on, who's checking on your well-being or checking up with the doctor. And for discharge purposes too, kind of like the homeless thing. We were talking about the homeless situation. It's also good to have context in case you live with them until, once you get out, or you need someone to pay your bills while you're in there. You may be in there for a month or a week. You need someone to I need you to, pay my smart bill so my food doesn't, die out in the fridge. Or so there's a lot of life things too that you need help with someone who's on the outside, which is very important. People don't think about.